So good morning, everyone. I'll be discussing about visual standards for the armed forces as such. There are various rulings which are available. First, for the officer's entry into the armed forces in the army, this is a letter of 16 July 2019. Now, if we see the various institutes or which take the individuals, young individuals from different sphere. So starting with the admissions to NDA in Army 10 plus 2 equivalent. So in this, the unaided visual acuity which is acceptable is 636 in both eyes with the corrected visual acuity of 6.6. Myopia of minus 2.50, hyperopia of plus 2.50, and a cylinder of plus minus 2 diopter cylinder. So the combined error should not be more than 2.5. So this is what are the standards for entry to NDA Army. The LASIK and equivalent are not permitted at this age for entry to NDA. Now, the next is for the officers who are entering in the IMA, OTA, and women entry scheme and combined defense services. Here the standards are unaided visual acuity by Snellen chart of 6/60 in both eyes, the corrected visual acuity of 6/6 in both eyes, myopia of minus 3.5 diopter sphere, hyperopia of plus 3.5 diopter sphere, and a cylinder of plus minus 2 diopter cylinder. The LASIK and equivalent are permitted in this. In NDA it was not permitted, but if you see the IMA, the LASIK and equivalent are permitted. The next is officers in the Judge Adjutant Journal, so education, RVC, AMC, ADC. In these, the unaided visual acuity, which is acceptable, is 3/60 both eyes. Corrected visual acuity is 6/6 both eyes. Myopia of up to minus 5.50 diopter sphere is acceptable. Hyperopia of 3.50 diopter and astigmatism of plus minus 2 diopter cylinder is acceptable. The LASIK and equivalent are permitted in these. Now, next is admission to Armed Forces Medical College. Now, here the visual acuity unaided is 6/36 both eyes, with correctable to 6/6 both eyes. Myopia of minus 3.50 diopter sphere, hyperopia of plus 3.50 sphere, and astigmatism of plus minus 2 diopter cylinder. These are the visual standards for admission to AFMC, and LASIK is not permitted here. Admission to RIMC, Scenic schools or military schools. Now there are two standards in this, standard 1 and standard 2. In the standard 1, the child has to be 6/6 both eyes. In standard 2, by Snellen, it has to be 6/18 both eyes, correctable to 6/6. The myopia and hyperopia of plus and minus 1.5 diopter cylinder are acceptable, diopter sphere are acceptable, and the astigmatism of plus minus 0.5 diopter cylinder are acceptable. The LASIK and equivalent are not permitted. The Army Aviation. In the Army Aviation, there are two types of entries which happen. One is the direct entry, other is the lateral entry. In the direct entry, the unaided visual acuity of 6/6 and 6/9, correctable to 6/6 both eyes. The myopia of 0.5 diopter sphere, hyperopia of plus 1.5 diopter sphere, and astigmatism of plus minus 0.5 diopter cylinder is acceptable. LASIK and equivalent is not permitted. Whereas in the lateral entry, the 6/12 is unaided visual acuity acceptable to correctable to 6/6 both eyes. Myopia minus 1 diopter sphere, hyperopia of plus minus 2 diopter sphere, and astigmatism of plus minus 1 diopter cylinder is acceptable. And here the LASIK and equivalent are permitted. Now, if an individual has undergone LASIK and equivalent, what should be the criteria that we should see in those patients? The age at the time of surgery should be more than 20 years. There should be a minimum 12 months post-surgery. The central corneal thickness has to be better than 450 micron. The axial length by IOL master should be less than or equal to 26 millimeters. And residual refraction should be plus minus 1 diopter sphere, including cylinder. So, and the retina should be normal and healthy. So these are the criteria which one should look for. Admission to NDA in Air Force. The criteria are 6/6 and 6/9, correctable to 6/6, no myopia. Manifest hypermetropia should be less than 2 diopters, and astigmatism should be less than 0.75 diopter. Similarly, if you see at the initial entry for the fighter pilots, ATC, air crew other than fighter pilots, and flight controller, these are the criteria. In all these cases, if you see the the visual acuity, if you see in the fighter pilots, is 6669 is unaided, correctable to 6666. In the air traffic controller, 6969 correctable to 66. In the air crew other than fighter pilots, it's 624 and 636 correctable to 66 and 69. And in the fighter controller, 636, 636 correctable to 6666 with the respective myopia, hyperopia, and astigmatism that you can see in this slide. I think most of these other cases will be covered in the Air Force and Naval standards. So I'll just skip this to mainly now Navy has got its own standards starting from V1, V2, V3. I think these will be covered subsequently. Okay. So I'll just show one more slide of Agniveers. So in the army, if you see the soldiers, these are the normal soldiers, and then there are Agniveers. So in normal soldiers, when we are taking, there are only two visual standards of recruitment of other ranks and soldiers. The soldier GD, gunner and driver and equivalent will continue to require unaided vision of 6.6. And the other category of recruits, they have been grouped in the second group, and they will require the NDA vision standards. So this is the first group where the unaided visual acuity has to be 6.6 in both eyes, and this is the other group where the soldier technical, clerk, SKT, nursing assistants, these will require unaided visual acuity of 636 correctable to 6.6 with myopia of 2.50 and astigmatism of plus minus 2 diopter cylinder will be required, and LASIK is not permitted in these. And in Agniveers, you have got two types of standards. I think this we had some issues in the initial time. Agniveer GD and Agniveer clerk and SKT. So in the Agniveer GD, 6.6 vision, unaided and corrected. And in the Agniveer clerk, SKT, nursing assistant, the 636 both eyes correctable to 6.6 with the same as NDA standards, and the LASIK is not permitted in them. The rest of the standards will be covered in subsequent talks. Thank you.
Thank you, Colonel Vijay. He's covered the basically the army part and a bit of the refractive surgery. So you can see there are a various number of standards which are applicable. The basic thing which comes across is we have standards are titrated according to the age of entry. So it is it compensates for the refractive errors which change with age. So you have somebody entering at 17, 18. You have somebody entering the Sainik school at the age of 11, 12. So the standards are correspondingly lower. So they correspond to the changes in the refraction which take place at the age of 18, 20, and similarly for the refractive surgery.